Namaste friends, welcome to Bano Biology Center for True Learning. Here I request you to subscribe our YouTube channel Bano Biology Center for more videos and press the bell icon for latest notifications and updates. In the previous video, we talked about sexually transmitted diseases, especially curable sexually transmitted diseases. There are two, one is syphilis, another one is gonorrhea. In this video, we are going to learn remaining two curable sexually transmitted infections. First one is chlamydiasis, another one is trichomoniasis. About these two, we have discussion. The chlamydiosis is another type of sexually transmitted infection caused by the pathogen called Chlamydia trachomatis. Chlamydia trachomatis is the pathogen responsible for chlamydiosis infection in both males and females. How chlamydiosis spreads? Chlamydiosis transmitted or spreads from one person to another person by vaginal sex or oral sex or anal sex. Here, the sexual contact is the predominant cause for spreading of the chlamydiosis infection. Here, it also spreads through the direct contact with the infected tissue as conjunctiva. The conjunctiva is the tissue present in the eye. When person affected with the chlamydiosis, especially conjunctiva tissue of that person, when a healthy person touches the conjunctiva tissue, the spread of chlamydiosis infection will become easy. Here, in non-sexual form also, this infection spread from one to another. It passes from infected mother to the baby during the pregnancy time also. Almost all kinds of sexually transmitted infections have a chance of occurring to the developing fetus at the time of birth from their infected mother. Chlamydiasis affects about 4.2% of women and 2.7% of men worldwide. Chlamydia is also called silent epidemic because in majority of the females, the symptoms of chlamydiasis, I mean, it may not causes any symptoms in women. Because of that reason, the chlamydia is also called a silent epidemic. Here, the picturization of chlamydiasis infection is given. This is the infection in the mouth. So this is conjunctiva, occurs in the newborn baby. This is the conjunctiva, the conjunctivitis in the eyes of adults. This is the infection in the mouth of a person. In infants, the conjunctivitis leads to the permanent blindness and also pneumonia. Let us see symptoms experienced by the men and women due to the chlamydia infection. In men, some symptoms like itching, pain while urination, then discharge from the penis, then inflammation of urethra, then unusual discharge from the genitals, then testicular pain, which leads to, it also leads to the sterility by causing epididymitis, and by affecting the epididymis part of the male reproductive system, it leads to the sterility. Then prostate inflammation. Of course, half of the men may not show the symptoms in the earlier stages. Next, the symptoms appearing in women: the burning while urinating, then vaginal discharge, then bleeding between the menstrual cycles, then increase in pain during menstruation or during the intercourse, then abdominal pain or lower back pain, then fever and chillness. These are the some symptoms uniquely appearing in both and men and women. There are some symptoms commonly appear in both male and female, like discharge, redness in the infected area, and painful bowel movements and itchiness. Then how to treat the chlamydia infection? There are some medications available. By taking the medications in proper way, the infections can be completely cured if it is diagnosed in the earlier stages of infection. Treatment: here two medicines are given. One is doxycycline, another one is azithromycin. Here the doxycycline available in the dose of 100 milligrams, so which can take by mouth 2 times a day continuously for 7 days. Another medicine is azithromycin. It is available in the dose of 1 gram. It also can taken by mouth once in a day. So in case of pregnant women, if any pregnant woman found with the chlamydia infection, so there is a separate medication. So one is erythromycin, which is available in the dose of 500 mg. It can also taken by the oral for 7 days continuous. Another one is amoxicillin. It is also available in the quantity of 500 milligrams. It also taken by the mouth, I mean orally, for continuously for 7 days. This is about the medication for chlamydia infection. Next, another the curable sexually transmitted infection is trichomoniasis. The pathogen which is positive trichomonias pathogen is Trichomonas vaginalis. Trichomonas vaginalis is a flagellated pathogen which causes trichomoniasis infection in humans. Firstly, Trichomonas was identified by Alfred Donne in the year of 1836. It mainly affects the vagina, urethra, and the parts under the skin of a person. This infection also transmitted through the sexual contact with the infected person, and also through the genital touching. By genital touching and by sexual contact, trichomoniasis infection can transmitted from infected person to the healthy person. Let us see what are the signs and symptoms of trichomoniasis. In case of females, it causes severe illness like urethritis, I mean inflammation of the urethra, then vaginitis, inflammation of the vagina, cervicitis, I mean inflammation of the cervix region. It also causes inflammation of the vaginal canal, then vulvar region with itching lead to the edema, then tenderness and chafing, then redness around the affected area, infected area, then discharge, so which is foul smelling and appearing in yellow and green color, then pain while urination, which is called dysuria, then pain occurs during the sexual intercourse called dyspareunia, the punctuate hemorrhages on the cervix region, which is also called colpitis macularis or strawberry cervix. These are the some symptoms. In case of males, the symptoms appearing are the discharge in whitish color, then pain and burning during the urination, then urethral discharge, then balanitis, I mean balanoposthitis. The inflammation of glands penis and prepuce is called balanitis. The rarely prostatitis also found in the males. These are the few symptoms appearing in both male and females due to the trichomoniasis infection. Is there any proper treatment for the infection? Yes, there is a treatment available. Before that, you give a small look at the given picture. This is the Trichomoniasis infection caused by the Trichomonas vaginalis pathogen. Come to the medication. Metronidazole, tinidazole are the prominent drugs can effectively work against the infection. Metronidazole in the dose of 500 mg in the form of tablets given in a single dose. In a single dose, infected person has to take 4 tablets in the dose of 500 mg each. Another chemical, tinidazole, which is also available in the dose of 500 mg. 4 tablets need to take in a single dose. Then metronidazole 500 mg, 1 tablet twice, I mean 2 times a day for 7 days continuously. Thank you for watching this video.